Hello everybody, and I'm Dr. O. See you again. Our today's lecture is about interstitial nephritis. Okay, let's go on. First, let's see the purpose and requirement of today's lecture. So first is master the definition of interstitial nephritis. And next, understand the classification of interstitial nephritis. And also understand the pathological of interstitial nephritis. Then master the clinical manifestation of interstitial nephritis. And last, master the treatment of interstitial nephritis. First, let's see the definition. So, interstitial nephritis is also quite known as tubular interstitial nephritis. It is a group of clinical pathological syndromes, can caused by a variety of causes, which are primarily located in the renal tubules and interstitium. So, the injured lesion, is on the renal tubules and interstitium. And the classification, we always include acute interstitial nephritis and chronic interstitial nephritis. Before we study the interstitial nephritis, let's see the renal interstitium. Here, like the red arrow indicate here. Okay, everybody knows here. So many inflammatory cells in the interstitium. So the renal interstitium is distributed between glomerulus and renal tubules. Like here, so many renal tubules, including connective tissues, blood vessels. Now, in these pictures, there's no blood vessels. Sometimes with lymphatic nerves, and in these pictures only interstitium and renal tubules with so many inflammatory cells infiltration. And let's see the function of renal tubules and interstitium. So first, the function is substance transport. Okay, include secretion and reabsorption. As you learned. Maybe next session. Maybe 1 or 2 years ago. You learned it. And the second function is electrolyte balance and acid-base balance. Okay, water balance, endocrine function, especially EPO. EPO is the hormones in the interstitial excretion. One of hydroxynates. One of hydroxynates. So first, let's see the acute interstitial nephritis. Who knows? Acute. How to define it here? Acute is in our clinical practice always the period of the happen of the disease. Is more often less 1 month. 1 month, maybe 1 week, maybe I think maybe 2 weeks. Always less 1 month. So acute interstitial nephritis, the definition is here. Let's see the picture. Okay, it's a group of acute renal disease characterized by inflammatory so many inflammatory cell in which one? Infiltration and tubular degeneration. Here maybe the tubular degeneration. This is the definition. So you can remember here, characterized by inflammatory cell infiltration in the in the interstitial and tubular degeneration. Okay, there are as I said before it, so many etiology. Different disease can cause the interstitial nephritis. So first, this is most common in drugs. For example, any antibiotic, and sometimes NSAIDs, or anticonvulsant drugs, diuretics, in China, maybe it's Chinese herb medicine. We don't know so many drug in this group. So the drugs is you first to imagine or in your mind will induce acute interstitial nephritis. The second etiology is infections. Maybe acute. Next lecture we learned acute urinary tract infection. Then the last idiopathic. How to define idiopathic? The definition is exclude the drugs, infection, and some other disease. For example, systemic disease cause the acute interstitial nephritis. So then we call it idiopathic. So be careful of the drugs. Let's go on. Let's see the pathology. Here the picture indicate here the red arrow. Here there are so many inflammatory. Maybe here and here so many. The right picture indicate here in so many inflammatory cell infiltration, and sometimes with the interstitial edema here, maybe here interstitial edema, and with tubular vacuole and granular degeneration, like here, this cells, epithelials of the tubular tubules, granular degeneration. The character is I think inflammatory cell infiltration is the main lesions in the interstitial area. So there are here so many, maybe sometimes other nucleocytes, monocytes, so many cells infiltrate, sometimes with other, like the picture here, with the tubular, here, this is the injured tubular, degeneration. Sometimes here, atrophy, inflammatory cells infiltration. Then let's see the clinical manifestation. If you face one patient, the symptoms, you should remember in your mind, what happened these patients. First is fever. Okay, maybe there's not a high temperature. Sometimes it's only 38 centigrade, maybe next 38 centigrade. Okay, and sometimes with the upper or lower extremity, with rash. Okay, always with rash. The patients will feel each inch. Okay, sometimes, and sometimes with I think it's arthritis, or we call it arthralgia. Okay, and sometimes in the back, there's sometimes the patient will have backache, but this is not a specific symptom. Sometimes, some patients will have renal impairments, 20 to 50% patients. Okay, always have oliguria, hematuria, proteinuria, but this time the proteinuria, I think, is not massive. It's only 1 plus or 2 plus. Always less 1 gram per day. Okay, and sometimes with sterile leukocyte, occur cytopenia and sometimes with impairment of renal function. Okay, so different people, different maybe it's a mild patient. This patient will not have renal impairment, but if the patient is the severe patient, yes, the interstitial nephritis, it's very severe. Maybe this the 1, 2, 3, 4, and 5. This 5 syndrome. I think so will happen in the acute interstitial nephritis. Let's go on. Yes, see the diagnostic principle. Okay, so first you should ask the patients whether or not they have a history of allergic drug use, and then you should to know that the patient will have systemic nephritis and sometimes with some laboratory abnormal. Okay, so here urine test maybe in the urea analysis, hematuria. Okay, do you remember the definition? Okay, more than 3 cells in the high power of urine sediment. Okay, proteinuria, as I said, always then it's about 1 plus or sometimes 1 less 2 plus, always less 1 gram per day. Yes, the proteinuria, and sometimes with sterile nucleoside. Yes, no urinating symptoms. Okay, and sometimes impaired glomerular filtration. The gold, here I emphasize here the red word. The gold standard test, gold standard test is recommend the patient to receive a renal biopsy. Here renal biopsy. Yes, there's no one. Why? Okay. I write maybe this picture covered here. Renal biopsy is very important to diagnose acute interstitial nephritis, but sometimes the patient will not to receive or to make a renal biopsy. Because these patients use the steroid, the treatment response is very good. Okay, so in clinical practice, there's no need to every patients to receive the renal biopsy. So let's say the treatment. Okay, so if a patient maybe sometimes have fever, rash, arthritis, backache, or sometimes with the impairment of renal function. So there's some principle you should study. First, if this acute interstitial nephritis is caused by drug. Okay, first is to stop allergic drugs. So maybe sometimes in antibiotics, sometimes NSAIDs. Okay, sometimes diuretics drugs. Okay, no matter what may happen. So first stop allergic drugs. Okay. The second, if you this can cause the infection, use some antibiotic, antivirus. Okay, infection control is very important. Sometimes with supportive therapy, as I said, control blood pressure. Use some painkiller. Okay, use some. I think use some drugs to control the symptom of the patients. Okay, we call it supportive therapy. Okay, and last is steroid or immunosuppressant. If the patient is with acute severe interstitial with edema, with so many inflammatory cell infiltration in the station. Okay, and with the impairment of kidney function, then you can choose steroid. But now the dosage is not like the, as I said, the next two lecture said, not like the nephrotic syndrome. Yes, we only use the about 0.5 milligram per kilogram per day. Okay, for example, if the patient the weight is 50 kilogram, okay, we always use the prednisone 25 milligram per day is okay. So here I also emphasize here, removal etiology is very important. As I said, if an acute interstitial nephritis caused by drug, okay, remove the stop the use the drug. Then if it caused by infection, use some antibiotic, control the infection, okay, with some supportive therapy. And seldom, I think seldom we use the steroid or immunosuppressant drugs. To remember the immunosuppressant drugs, as I the last lecture, cytosporin, tacrolimus, okay, sometimes mycophenolate morphetal, okay. So this is the very common use immunosuppressants to treat the severe patients, okay. So next, let's see the chronic interstitial nephritis. Okay, this time, here chronic. Do you know? Yes, more than 3 months. Okay, more than 3 months. The period, we called chronic interstitial nephritis. Let's see the definition. It's a group. It's a group of clinical pathological syndromes characterized by tubular atrophy. Here, I indicate here, tubular atrophy with the renal tubular, became small, and the capsule line is, I think, is increased. Then the size is became very small than the normal. Here, maybe this is not normal, but sometimes the size is small. Here small. With tubular atrophy and interstitial. Here interstitial fibrosis. Okay, fibrosis. The green area here. So many interstitial fibrosis. Etiology. As the acute interstitial nephritis, the chronic disease also can cause by, but the most common is infection. I think that's last lecture I tell you in the urinary tract infection, chronic pyelonephritis. This disease is the most common to cause the chronic interstitial nephritis. And second is sometimes with the Sjogren syndrome and some other immune mediated disease. For example, SLE, systemic lupus erythematosus, and some other connective tissue disease can cause the chronic interstitial nephritis. And here, the number 3 factor is etiology is drugs. For example, for instance, NSAIDs also can cause with the patient will receive this drug for a long time. In my clinical practice, there's one patient receive NSAID for about 20 years. Okay, the patient feel backache and sometimes arthritis. Maybe sometimes headache. Okay, they always use these drugs. It's very common in China, maybe in your country. So be careful. Also here, say here, be careful of drugs. Okay, medication. This is very important. The next is I see here. In China, in Guangxi province, in Guilin. So many patients or the people have their I think we call it kidney stone. Urinary tract obstruction. Also can cause the chronic interstitial nephritis. So this is the etiology. Let's see the pathology. Like I said that. Here, maybe in this one, this one. Maybe it's just not normal, but here so many. The size of a renal tubule becomes small. Small. We call it tubular atrophy. And with some inflammatory cell here, in some inflammatory cell infiltration, yeah. But this time in chronic interstitial nephritis, the inflammatory cell is leukocyte, yeah. Maybe in the acute, yeah, in acute interstitial nephritis, the inflammatory cell is maybe sometimes the important neutrophil cells infiltration, and with so many here, so many here, interstitial fibrosis. So remember, in chronic interstitial nephritis, the pathology is tubular atrophy, interstitial fibrosis, and inflammatory cells infiltration. Yeah, here indicates leukocytes, or sometimes we call it monocytes. Okay. And sometimes here, this is very special here. Yeah, so many, yeah, inflammatory cell leukocyte infiltration here. Yeah, interstitial, the interstitial fibrosis here, yeah, the size of renal tubule, yeah, becomes small, so small. Yeah, I think so. Okay, let's see the clinical manifestation. Yeah, manifestation is very important for you to remember, because yeah, the patient in front of you, so you should know, yeah, what's the symptom, yeah, of this disease. Okay, first is not like the acute, yeah, not like the acute interstitial nephritis. Yeah, here nocturia. Yes, this is very important. So in clinical practice, yeah, you always first to ask the patient whether or not to have nocturia. Yeah, especially when, yeah, after your dinner, yes, you don't, yeah, drink water, but in maybe 2 a.m., 3 a.m., yeah, there may be 2 or 3 times, yeah, you should want to, yeah, go up to urinating. Yeah, okay, we call it nocturia. Sometimes the patient will have fatigue. Yeah, why? Because the patient will have anemia. Yeah, anemia, so the patient will feel fatigue. Sometimes with the so many here, I say that interstitial fibrosis and so many tubular atrophy here. Okay, the patient will have hypertension. Yes, hypertension. The renal tubule and interstitial injured. Okay, the patient will have hypertension, especially, yeah, in the advanced, stage, yeah, the patient will have renal impairment, and in the severe patient always have renal impairment. So here I write here renal tubular transport dysfunction, renal tubular acidosis, and urinary, yeah, concentration dysfunction always happen in this patient. Sometimes the patient will have, yeah, in the laboratory test, yeah, hyperkalemia, yeah, always have, yes, different patients have different, yeah, sometimes the eGFR is decreased. Okay, let's go on. Yeah, so how to treat the chronic interstitial nephritis? Here, I write here. First is to warn the patient if it's a chronic urinary, yeah, tract infection. The infection control is first. Yeah, then supportive therapy. For example, yes, here, yeah, blood pressure control, and use the EPO, yeah, to treat anemia. Yeah, we call it supportive therapy. If the patient have edema, yeah, you use diuretic drugs to relieve these symptoms. And sometimes, yeah, the patients have chronic interstitial nephritis, maybe, yeah, with so many years. Yeah, the patient will always have chronic renal failure. Yeah, in the next lecture I will teach you, yeah, chronic renal failure. There are so many complications, yeah, you should treat. For example, with the heart failure, sometimes with the sometimes with the cardiovascular disease, sometimes with the pneumonia. Yeah, so many yeah, complications of chronic renal failure you should face. Yeah, so use the and yeah, different treatment to treat the chronic renal failure. So yeah, today's lecture, I think, in my mind, I think it's easy for you. Yeah, I think it's just interstitial nephritis. Yeah, okay. The first is to the definition, yes, etiology and clinical manifestation. So you should master the definition of interstitial nephritis. Yeah, include first acute interstitial nephritis. Yeah, and second chronic more than 3 months. Yeah, interstitial nephritis. Okay, then understand or master the clinical or and pathological manifestation. Yeah, as I said that in acute, interstitial nephritis, so many inflammatory cells infiltration in the interstitial, and in the chronic, the pathological, yes, is like the patient will occur with tubular atrophy, fibrosis, yes, interstitial fibrosis. Okay, so difference. And thus the treatment, I think the treatment principle is the same. Yes, first is to supportive control, like blood pressure control, and sometimes we use some diuretic drugs to control the edema, and sometimes use some, especially in the moderate or severe patients, you can use some prednisone or immunosuppressive to treat the acute interstitial nephritis. Okay, but here I emphasize here. This is very important. You see the face. I think it's not friendly. Oh yes, I think so. Yes, whether or not you use any drugs. Yes, in our Chinese, this word it says one drug have 30% effect, but 70% of poison. Okay, so their face, I think it's not a friendly. So especially in China now, in our department, we see so many patients to eat the Chinese herb medicine for a long time. Then the patients will have acute, sometimes I think happen in a chronic interstitial nephritis. Then the patient progress into chronic renal failure. Then what a pity. I always say in my department, what a pity. If the patients don't care about their drugs, their medication, their treatment, I think in clinical practice, so many patients use the wrong drugs for a long time, then have the renal impairment occurred. So be care of medication. Be care of every drug you use in clinical practice is most important. Okay, so thank you for attending for today's lecture. I think it's very short, but maybe it's different. Students will have different concern about today's lectures. So here I conclusions. You just to understand or master the definition, clinical manifestation, pathological manifestation is okay. Then remember the treatment principle. Like here, right here. The nephritis control, the treatment. Remember the principle is very important. Infection control, blood pressure control, and treat the anemia. Diet control, and use some drug to treat the complication. Like here, if the patient is a chronic interstitial nephritis, then you should choose the drug to treat the complication. For example, chronic renal failure. In the acute interstitial nephritis, you can use some I think prednisone or some other immunosuppressants. The treatment principle, I think different people maybe sometimes have different treatment principle, but I think it's always just two sides. First yeah, control symptom. Okay, let the patient feel, yeah, feel good, yeah, relieved the symptom. Okay, the second is to find the etiology. Yeah, find an etiology to cause the disease. Then use some drugs to treat the etiology. It's okay. If the patient is infection induced, yes, the chronic interstitial nephritis, yes, use antibiotic to control the infection is okay. If the patient, yeah, is the drugs, yeah, cause the acute interstitial nephritis, then use the first, yeah, stop this drug to use, yeah, it's very important. Then sometimes use some, yeah, drugs to control blood pressure, to relieve the proteinuria, and use some prednisone. Okay, so I think today's lecture is very, yeah, I think it's very easy for you. So remember that be care of every drug, every, yeah, medication in your clinical practice. This is today's, yeah, I want to tell you to remember, yes, be care of, yeah, 30% effective risk, yeah, but with 70% of poison. Okay, so thank you for you to attend today's lectures. Yeah, hope you can, yeah, ask some questions for me. Yeah, in the next lecture, so many lectures. Yes, I think maybe you learn is maybe, yeah, you think it's easy, yeah, but I think in this is the basic knowledge, yeah, basic knowledge, yeah, of our department disease. Okay, in the real, yeah, real modern or real, yeah, the clinical practice, the disease is, I think, is more complicated. Yes, if you have time, yeah, I hope you, yeah, yeah, pass the neuro, yes, the coronavirus infections, yes, the time, yes, I think you have time to get our department to see the patient, what happened, yeah, what symptoms and manifestation, yeah, what happened, then how to see the laboratory test, and then use your diagnosis principle to diagnosis. First, diagnosis precision, and then choose the, I think, the standard treatment regimen is very important. So thank you for you. Yeah, for I will, yeah. 1 week later, yes, we will, yeah, discuss this today's lectures in the WeChat group. Yes, hope see you in that time. Okay, so thank you all the same. Yeah, for you. Yeah, yeah, thank you. Yeah, see you 1 week later. Okay, see you.